So the Democratic Republic of Congo, Uganda and South Sudan have adopted a joint plan to try to counter the spread of the Ebola virus across the region. Following a meeting in Uganda attended by health ministers and aid organisations, the three countries most affected by the outbreak say the new measures and plans will help coordinate their response. Now, the DRC is the country with the most cases, and the response there has been hampered by the insecurity in the east of the country. Medical teams are unable to reach areas under the control of the M23 rebel group, which is at war with the Congolese government. The outbreak has so far resulted in more than 200 deaths and 860 suspected cases. We can speak now to Dr. Abdou Sebushishe, who's with the International Medical Corps and joins us now from the eastern DRC city of Goma. Welcome to the programme. So you are operating in a rebel-controlled part of the country. What are you able to see on the streets? What do you know of the response there to try to deal with Ebola?
Thanks for having me. International Medical Corps operates across the country, across the whole of DRC, especially in hotspots where cases have been identified of Ebola. That include of Ituri province, but also North Kivu and South Kivu, where cases have been identified. And the concern is about the large number of suspect and confirmed cases that are being reported every day across geographically apart places, which increase the fear of seeing a sustained community transmission across all the areas that have been affected by this outbreak. And particularly, this outbreak have been identified in areas with sustained insecurity, but also humanitarian needs that have been going on for years, which hamper sometimes the contact tracing of people who have been in contact with confirmed cases when they go back to their community that are not reachable due to insecurity or other factors.
And so what are the health prevention measures in place in Goma?
Currently, they have been developed a response plan that all the humanitarian actors, but also response partners are working on to ensure prevention measures are being placed at the border, at the entry point of Goma and other locations, but also in health facilities to ensure that health staff, but also the regular health services keep going on, at the same time provide sustained care for those who are affected by this disease.
Because we did hear in recent days concerns that health and aid workers have not been able to get to infected people after the main airport in Goma was closed. People had to go into that part of DRC through Rwanda and Uganda. Is that hampering the health effort as far as you're concerned?
As a humanitarian organization, we are neutral politically. So it allows us to work directly with community and get access to different areas that are in need by the community themselves and the affected population, which facilitate humanitarian actors to reach all the location where the need is and provide the services that the community need. And that is being done in coordination with the local communities in all areas of DRC that are being affected by the disease.
Yeah, you have to work in the conditions in which exist and the political system which exists. Do you have all the resources you need then to respond to this public health emergency?
That's one of the major needs that is currently hampering the whole response. Is that this outbreak happened just few months after another, the 16th outbreak of Ebola that happened in Kasai province. And during that outbreak, which was quickly contained, a huge stock of protective gear that health care workers use for treatment of suspect and confirmed Ebola patients were used and was not yet replenished due to many factors. And that caused a shortage of personal protective equipment for health care workers, whether those working in Ebola treatment center or in regular health facilities. and that one of the factor that we have more than 20% of those who are affected to be healthcare workers, and it's quite concerning as it can directly affect the provision or the continuation of regular health services such as children vaccination or delivery of mothers or treatment of malaria, in addition to the care for Ebola patients.
So health workers are more at risk in Goma than perhaps in other parts of DRC because of this shortage of personal protective equipment?
I think it's across the board. When this an epidemic like Ebola require a lot of resources, especially the protective gear, but also the infection and prevention and control supplies that and have to be deployed in many area health facilities, in communities, in treatment centers, and that require a huge system of replenishing it and evaluating, forecasting the need, and that haven't been done across board. We are very hopeful because we are seeing the engagement of more actors to ensure that the protective gear and the necessary supplies are being provided to facilitate the response.
So you hope that they'll be replenished soon then. Thanks very much indeed. That's Dr. Abdou Sebushishe there from the International Medical Corps joining us from Goma.